Hello everyone. My name is Dr. Anvesha. Today I'm here live with Dr. Sheetal. Soon she will join us. So today we are going to discuss about postpartum care in Ayurveda. Waiting for Dr. Sheetal. Just waiting for Dr. Sheetal to join us. Just we are going to have a very interesting topic today. Postpartum care in Ayurveda.
Just a second. Hello, Anvesha.
Hello. Just so sorry, was having some technical issues.
Sure, sure. Let me just adjust the camera. I'm really sorry.
So
Just a second. Just give me a couple of minutes. I'll just. Hi.
so glad to have you here. I'm just so honored because you share some really a very knowledgeable post. So I'm really happy to have you in my live session. And
Thanks a lot. Thanks a lot.
especially in this topic regarding postpartum care in Ayurveda. Now was
Hmm.
the means nothing means no one was able to discuss this topic more than you.
Thank you. Thank you. Thanks a lot for inviting me. Am I audible and it's all good, right?
Yes, yes, yes.
Okay. Fine, fine, fine. So we should we directly start the topic or how do we go ahead?
Yeah, yeah, yeah. Start the topic.
I'll start, right? Okay. Uh, just a second. I will just. Can you pin the topic? Do you know how to pin the topic, Anvesha?
Yeah, there's the postpartum care. And like first, I would love if you would give a bit of means introduction about the
Sure,
postpartum. Means what it is called in Ayurveda, the correlation. It would be good.
sure, sure. First of all, good evening to everyone who has joined us. For those of you all who don't know me, my name is Dr. Sheetal. I am an Ayurveda practitioner and I have been practicing Ayurveda for 6 years. And I have a daughter now who is 1 year old, so that makes me an apt person to talk about postpartum. So basically, whenever we talk about postpartum in Ayurveda, Ayurveda is a beautiful science which talks about, like, for example, we talk about Ayurveda in all parts of our life, right? From childhood to say pre-pregnancy, pregnancy, delivery, post-delivery. So in today's more on the post-delivery part or the postpartum part, or what we call in Ayurveda is your Sutika Avastha, right? So all the Ayurvedic students already know the word. For laymen, Sutika Avastha is an Avastha basically, where a lady is considered as Sutika. This is post-delivery. So there are different references. There are different, what we say, writers who have different opinion about Sutika Avastha. But roughly, if we look into it, we can say that Sutika Avastha is more or less like 45 days post delivery, or what we can call it as until and unless a lady gets her menses back. So that whole phase is called as Sutika Avastha. Right from delivering the baby, so once the baby is delivered, the placenta is delivered, from that point till the time she gets a menstrual cycle, that period is called as Sutika Avastha. So now, for example, Sutika Avastha is a very important phase. So Like for example, most of the ladies gets periods, some gets periods after 6 months, some gets periods after 1 year. So apart from that, it is said that we have to take lot of care in the first 40 to 45 days post delivery. So that is the most important period of Sutika Avastha. Obviously, a lady has to take lot of care later also, but this is the period they say that if you take care of your body in this first 45 days, you don't have to take care of your body for like, I mean to say, you won't have issues related to post delivery for say 10 to 20 years of your life if you take proper care during this period, right? So, like for example, whenever we talk about post delivery, you already know that a lady undergoes lot of what we say, there's lot of work happening in your body, right? It is actually so much work to carry, say, a 3 kg baby, a placenta, your membranes, your amniotic fluid, right? So there is lot of work happening for the 9 months in a woman's body. Also, labor, or what we call as prasav in Ayurveda, is also a difficult procedure. So maybe it is a C-section or it is a normal delivery. All this kind of deliveries take lot of toll on the women's body. That is the reason, and special care has to be taken immediately after delivery. So what happens in India, most of the time, what happens is like we are so engrossed in taking care of the baby. Even the mother is so busy in taking care of the baby that she forgets to take care of herself, right? Yeah. So like for example, like जब भी whenever a lady conceives, what happens is like सब लोग अरे अभी तुम pregnant होगी, now you have to eat for two, you do this, you don't do this, मतलब you don't eat this. But immediately after delivery, what happens is the focus shifts on the baby and the mother's health take a toll. बट मैं ऐसे नहीं बोल रही हूँ कि इंडिया में नॉर्मली ट्रेडिशनली देयर आर लॉट ऑफ प्रैक्टिसेस व्हिच आर फॉलोड, व्हिच आर टेकन केयर फॉर द मदर, बट स्टिल एक बैक सीट हो जाता है कि बेबी का हेल्थ को प्रायोरिटी दे जाती है और मदर को हेल्थ को थोड़ा सा बैक हुआ जाता है, ठीक है? सो आई वुड लाइक टू एक्सप्लेन इन लिटिल वे कि क्या क्या चेंजेस हो जाते हैं इमीडिएटली आफ्टर डिलीवरी, ठीक है? So we'll talk about in Ayurvedic perspective. I'll try to make it as simple as possible कि सबको समझ में आ जाए. So now, for example, as you already know, there are 3 doshas in Ayurveda: Vata, Pitta, and Kapha dosha. Okay? So what happens is during delivery, after delivery, your Vata dosha. Vata is responsible for say air and space in your body, or Vata is responsible for anything which is in motion, anything which is responsible for movements in the body is governed by your Vata dosha. तो क्या हो जाता है when you are carrying a 3 kg baby, you are carrying a placenta, so there is lot of space production happening in your body, ठीक है? So immediately delivery के बाद क्या हो जाता है कि body में बहुत सारा space develop होना start होता है. And as you already know, wherever there is space and air, your Vata dosha gets imbalanced. So like for example, the whole postpartum care focuses on taking care of your Vata dosha. Also, second thing what we have to understand is a lady has to, she loses lot of strength during the process of delivery. Delivery is a strainer's job, right? You must have already heard that some people go into labor, 16 hours of labor, 24 hours of labor, or even if it is a C-section. Like C-section is a major operation, right? It's a major abdominal surgery. So even that procedure takes lot of toll on your body. कि आपको anesthesia दिया जाता है, you have to take so many medicines and all. So all these procedures are making lot of changes in your body. Your body is tired. Also, you are losing lot of fluids from the body. Blood loss हो रहा है, fluid loss हो रहा है. All the essential things which are required for your body are getting lost out of the system. So first thing, as I said, we have to balance your Vata dosha. Second thing, apart from Vata dosha, a lady loses lot of strength. Lady loses lot of fluids from the body. There's lot of bleeding happening. So to enhance or to replenish the whatever loss has happened in the lady's body, for that we have to take care during the postpartum. And third thing, your Agni or your digestive system is lower down. So basically what happens is like immediately after delivery, your Agni or your digestive system goes down. So whenever we are dealing with postpartum ladies, we have to take care of these 3 factors. That is to take care of your Vata dosha, which has increased, to take care of your Agni, like for example, your Agni has lowered down, so we have to slowly increase your Agni. And third thing is to build the strength of the lady. Okay? Yeah, what do you think, Dr. Rishabh?
If you could just elaborate about the diet and the lifestyle, that would be good.
Sure, sure. As you already know, Ayurveda emphasizes a lot on diet and lifestyle. So there's lots spoken about dinacharya, rutucharya, all the seasonal regimen. So similarly for a mother, there's a lot of regimens which has to be followed. Like we are lucky to be Indians because most of these things are followed traditionally, right? So most of the Indian households have traditional backup. They know what to do immediately after dinner. So if you read the Ayurvedic text, you must have seen there is a mention of Sutika Gar.
Yeah.
Sutika Gar is basically when a lady goes in her 9th month or when a lady goes in a labor, she is taken away from the whole family and a special house is built for her with everything what she will belong. So a lady has to stay, like for example, in the Sutika Gar for example, for 40 to 45 days. Now, practically saying, it is not practically possible for us to build a separate house for a woman or something like that. And nowadays, it's a common practice to deliver babies in the hospital. There are very few places, maybe in Kerala, or there are few places in South where they have deliveries at home. But a common practice, what we see in the metropolitan cities, or which is a common thing, is like we deliver, we go to the hospital when we get our labor pain, we deliver the baby, and when we come back home, mostly on the third or fourth day, based on the hospital guidance. Or for example, if a lady has delivered through C-section, she's sent home after 5 days. So basically, when a lady comes home after 3 days, and considering the situation now also, it is best to keep the lady and the baby in a secluded area, right? Like for example, we make sure that she doesn't come in contact with a lot of people also for her own health, because what happens during delivery is the state is such that a lady is exposed to a lot of infection. It is very common for the baby and the mother to catch infections immediately after delivery. So that is the reason she is kept in a separate room. Also, Ayurveda scriptures talk very beautifully about that the house should be what we say, we should have a pleasant home, or for example, even the curtains we should use curtains so there is no direct sunlight entering, right? Like it's already said that your Vata dosha gets imbalanced. Basically, your Vata gets imbalanced post delivery. So we have to take extra care to balance your Vata dosha, right? So now, for example, whenever we talk about Vata dosha, we have to look into the qualities of Vata dosha. Like we talk about dryness, we talk about the cold quality, we talk about the mobility quality. So normally what we have to do is the diet and lifestyle what we introduce mother should have the opposite qualities of Vata dosha, right? Like for example, when we talk about Vata, so make sure the lady is not exposed to lot of air. हम लोग देखते हैं कि when a lady comes from hospital, they tie her hair and all of that. She doesn't oil her hair for a longer period of time. Yeah, put a cotton in the ears, right? Or for example, even they don't allow her to sit in the AC. This is only for the reason that her Vata dosha doesn't get imbalanced. Like anything which is cold, anything which is drying in nature, like your air conditioner, your what we say cold water, or your say a lot of air entry directly can increase Vata dosha. So that has to be taken care. Apart from that, whenever we talk about diet of Vata dosha, also, like most of the ladies post delivery have this big dilemma कि अभी I want to lose weight. Like
Yeah.
mostly 30 days after delivery, 40 days after delivery, they will have this thing. Acha, I want to lose weight now. But what
Okay,
we do is,
interrupting
if
you.
you, yeah,
Just interrupting you. In this weight loss thing, I just wanted to ask another thing to you. That is, means I have seen a lot of news in the newspapers, like many film stars are telling that after delivery, right after delivery, they are going to the gym for losing weight. And right now you're telling that the vata doshas, there is imbalance of vata dosh. So during doing the gym, also it can again means increase the vata dosh thing.
So
So
true, so true. Because Vyayam increases Vata. We already know that any sort of heavy exercises increases Vata. So immediately after delivery, like for example, at least the first 40 to 42 days, we do not recommend anything which is kind of gymming or heavy exercises. Walking, very good. Pranayama, very good. Meditation, very good. If you can do mild yogic asanas, very good, but do not indulge into gymming or do not do heavy exercises, right? If you want to lose weight post delivery, you have to start taking care right during your pregnancy time. Because most of the times, what happens is, because traditionally it is told that eat for two people, then most of the time people, what they do is they take a lot of rest, do not exercise during pregnancy, do not walk during pregnancy. They end up putting extra kgs, and then it is difficult to lose that weight. So if you don't put on extra kgs during your pregnancy, you will not have a lot of issues losing weight. And losing weight should never be your target immediately after delivery. So you have a lot of time to lose weight. Obviously, you can do a lot of exercises. You have to focus on nourishing your body, because, like for example, like there are so many things where people say that post delivery a mother is born with the baby, right? So it's a new life for the mother, right? So everything, she has lost her energy, she has lost her fluids, she has lost her mental peace also in all of that process, right? So here she has to focus in getting back mentally, physically, understanding what is happening, taking care of your body, nourishing whatever she has lost from the body. So that has to be taken. Weight loss can wait, yes. And if you are following what we say normal exercises, or if you were working out during your pregnancy under the guidance of your doctor, you don't have to do a lot of things to lose weight. Okay? Yeah. Also coming to the diet part, as I said, like post delivery, whenever you're eating food, whatever you eat gets converted into a lot of things, right? The food what you eat gets converted into your ahar rasa in Ayurvedic terms. Like for example, the food goes to the mother, the food goes to form your tissues, your blood tissue, your muscle tissue, and the third part goes to form your breast milk. Okay? So whatever you are eating has to be considering these three factors, that you are nourishing yourself, you are nourishing your baby through breastfeeding, and you have to nourish your bodily tissues also, that you don't uh, feel tired after breastfeeding, because breastfeeding is also a strenuous procedure. Okay? So whatever diet you are eating, like for example, whenever I talk about nourishing diet, basically take care of your agni. Like immediately after delivery, you don't have to eat a lot of heavy food. You have to slowly start introducing diet. Like for example, imagine you have undergone a panchakarma procedure or a detoxification procedure. Your body is tired. It has removed a lot of toxins in the body. So immediately next day after a vamana or virechana, we do not recommend go and have mutton or go and have chicken, right? We recommend a specific diet to be followed. Like start with rice kanji, peya, then go to vilepi, little bit thicker, then have your moong dal ka soup, and then slowly go to mutton soup. Similarly, when we start with diet post delivery, we have to follow this procedure, that slowly start introducing food which is a little bit lighter to digest, and then go for a heavier one. As I already said, that your agni, your digestive fire, is lower down. So make sure you are adding a lot of spices to your diet. So when I say spices, basically you're having dried ginger, you are having pepper powder, or for example, you are having fennel seeds, or you are having cumin seeds, so that you don't produce a lot of gas. As you already know, there's a lot of space produced in your body where gas can accumulate. Okay? You have to work in nourishing food, basically means your dairy, milk products, ghee, cow's ghee can be introduced, cow's milk can be introduced. Uh, Also food which will increase your breast milk production. तो योर फेन्यूग्रीक इज देयर, या हम लोग गोंद का लड्डू बोलते हैं जो टिंग का लड्डू रहता है, सो दैट इज देयर. एंड लॉट ऑफ simpler recipes, methi, fenugreek seeds ka kheer and all. So what you can do is, at this point, you can always consult an Ayurveda doctor for a proper diet chart based on your what we say health issue or health condition. Because what happens is, like, if you don't take care of the health issues during this period, you will end up having lot of issues later. कि बहुत सारे लोगों को बैक एक का प्रॉब्लम स्टार्ट हो जाता है, बहुत सारे लोगों को वी हैव सीन कि हेयर फॉल इशू स्टार्ट हो जाता है, टायर्डनेस हो जाता है. सो दिस आर द कॉमन प्रॉब्लम्स व्हाट वी नॉर्मली सी पोस्ट डिलीवरी. Yes.
Your
Apart,
voice is
yeah,
cracking.
okay. Is it
Your
better?
voice is cracking a bit.
Just a second. Is it better now?
No, just still it's cracking again.
Is it cracking?
And
Just a
your
second.
video is also not available. Your video is also not available.
Just a second. Let me just. Is it better? Just a second. Yes. Is it better now, Dr. Anvesha? No?
No, it's still cracking and your video is still not available. Video is not
Just
available
a
and
second.
still the voice is cracking.
Is it better now?
Yeah, it's
Hello?
better.
Hi. It's better, right?
Yeah, it's better now.
Yeah. I'm so sorry it started raining
But your
here.
video is not available.
Sorry?
Video is not available.
Video is not
I
available.
can't see you. Yeah, I
Just
can't
a
see
second.
you.
Should I rejoin? Or just a second. Let me see if I can do something about it. Because I can see you clearly.
I can't hear you also because your voice is again cracking.
Just a second. Just a second. Let me see if I can do something about it. Hello? Is it better now?
No, still cracking again.
Should I rejoin? Uh, just a second.
I think
एक minute.
I
Is
think
it better?
your voice is still cracking. It's your voice is still
Should I
cracking.
rejoin? Should I rejoin? I'll leave and rejoin. ठीक है? Hello.
Yeah, I can see you.
Just a second. I'm so sorry. Is it better?
Yeah, yeah, is it? Yeah, yeah. Now it's better. Now
It's
it's
better,
better.
right? I'm so sorry. It started raining here in Thane.
No, it's okay. Nothing to be sorry about. It's okay.
Okay, fine. So where were we? We were talking about postpartum diet and all.
Yeah.
So here I would like to also add, like for example, you already know that traditionally there are a lot of what we say smaller practices. What normally is done in a what we say in a household where a lady has delivered. Okay? Like for example, there are a lot of Ayurvedic practices. What I have personally done also, and we recommend our patients on normally which is written in Ayurvedic text. One is your abhyanga or your oil massage. So your abhyanga or your snehana, what we call in Ayurvedic terms, is very, very important immediately after delivery. One thing also because your vata dosha is increased. So to calm the vata dosha, we say that tela or oil is the best treatment for imbalanced vata. So to balance your vata, one is your abhyanga, which can be recommended for both the mother and the baby immediately after delivery. Obviously, we have to wait for the mother to come home. It is not possible in a hospital. So once the mother comes home, from the next day itself, you can start massaging to the mother. Like for example, there are a lot of ladies who does all these oil massages. But only thing you have to make sure that the oil massages are not very very strong, because I have seen these ladies, they are not professional therapists and all, right? So they put a lot of force, lot of pressure, so you end up having other problems. So what you can do is like a basic oil massage has to be done on a regular basis. If you do not have access to Ayurvedic oils, you can start massaging with your tilka tel, or if you don't have tilka tel, coconut oil. So basic massage abhyanga can be started. If you have delivered through C-section, if you have delivered through C-section, you have to wait for your doctor's guidance. If she gives you a green signal, you can start massaging. Because what happens is after C-section, because you have a lot of stitches and all, and you end up, if you start massaging immediately after C-section, you will end up having a sepsis problem. There can be infection if the oil enters the stitches. So you have to wait for your doctor. If she tells you, okay, go ahead, yes, you can go ahead for massages. If there is nobody to massage you, you can massage on your own. It's very simple, just applying oil in a circular manner to your joints and a long manner to your muscles. So wherever there are muscles, you are massaging in a lengthwise, and wherever there are joints, you are massaging in a circular manner. So this is a simple practice which has to be done, followed by hot water bath. So no cold water bath, no room temperature bath after delivery. So make sure you are having hot water bath. If you have access to an Ayurveda doctor, obviously there are a lot of herbs that you can infuse in your bathing. Like the shmul hota hai, yeah, there are a lot of medicines which can be taken, which you can add to your bathing thing. उसके बाद one more common practice what we normally do post delivery is your patta bandhana, or what we say stomach binding. So nowadays there are a lot of what we say belts which are easily available, which can be what you can do is after your bath, once you are done with your bath, you can apply those belts. That is also possible. Or the tummy binding, there are a lot of techniques to bind your tummy. So if you know somebody who can do it properly for you, yes, that can be done. Try and bind the tummy as much as possible, because we don't want a lot of air circulating in your body unnecessarily, because you will end up having muscles pain, you will end up having back pain. And also very important thing, immediately after delivery, try to stay away as much from the bright lights. Like for example, do not use mobile phones immediately after delivery, at least the first 2 to 3 weeks. Because what I have also personally noticed, like immediately after delivery, I was doing a lot of work on the phone, and slowly, what has started happening is my vision started diminishing, and it is very commonly seen because of the direct exposure. Also, your fingers starts paining. So make sure you take as much advantage of this period and rest. The body needs lot of rest, so that maternity leave is given for the lady so that she rests. She rests, and once she rests, her body replenish. Okay? Uske alawa, there is one more thing, what a common practice what we do in Ayurveda, it's called as Yoni Dhupana, or what we call as fumigation of the vagina. As I already mentioned that after delivery, your vagina is an entry route for lot of infection. So we make sure that after bath, there's a technique where you're fumigating the vagina through different herbs. There are a lot of Ayurvedic herbs, and there are also a lot of spices and all of these things what we use, like your carom seeds or your garlic and all of that. So through that, you're fumigating your vagina so that you do not have a lot of infections. Okay, so there is no infection passing through uterus. So these are the things what you can do. And these are common practices which is easily seen in our household, traditional households. But if you do not have exposure to this, get in touch with any Ayurvedic doctor, get in touch with any Panchakarma center. They will guide you on this. Okay. Also with this, there are certain Ayurvedic medicines which are prescribed so that your Vata doesn't get imbalanced, your Agni stays intact. So those medicines can be taken for 40 to 41 days under the guidance of Ayurveda doctor. They do not take any medicine directly over the counter कि ये medicine अच्छा है post delivery. So that is not recommended. But there are a lot of beautiful herbs in Ayurveda which can be taken post delivery, which will help you in improving your breast production, breast milk production, which will help you to soothe your Vata dosha.
Yeah. Another topic I would love you to discuss, that is, I think it's very trending right now, that is postpartum depression. It's very common nowadays, because I have came close those ladies who have gone through these postpartum depressions. Means it's really a very big deal nowadays, because again I means, like you told, like that means that mobile phone, I think that can be the cause of postpartum depression again. So if you could tell a bit about postpartum depression.
Thank you, thank you. And thanks a lot, Anvesha, for bringing this topic because it wasn't there in my mind, but this is very common. Maybe the only thing what is happening is people are not accepting it. Like, for example, if I tell an elderly lady that I'm suffering from postpartum depression, she would be surprised. Like, why should you be depressed? You just delivered a baby. You should be the happiest person in the whole world because you have become a mother. So, what is making you depressed? Correct? So, like, for example, sharing my personal thing, maybe like 10 years back, this term was not used. The ladies were depressed then. Maybe now we have a lot of exposure to technology and all of that. But apart from that, what happens, I can give you a personal, what we say, first-hand experience. Like, I was super excited throughout my pregnancy. Like, for example, the 9th month, I was waiting, ki kab hoga delivery. And I was super excited to meet my daughter. And like, wow, I'll have a baby and I'll be the happiest person. So through the delivery process, obviously it's a hectic procedure. It takes a lot of toll on your physical and your mental self. Like someone else would just tell you, relax, you'll be fine, you'll be better. But there's so much pain, so much endurance, and this pain is not just physically, it's also an emotional pain. And there are a lot of hormonal fluctuations happening in your body. So immediately after delivery, what happened was like, okay, I was happy for 1 or 2 days. And after that, I was so tired, like I couldn't do anything apart from sleeping, right? And the worst part, what has happened, like I couldn't connect with my baby. Like, for example, they say that, like, you become mother overnight, right? But I don't know the feeling of mother. Like, I was like, oh God, I'm so tired and I have to feed her. I have to stay awake whole night. Like, the first month is very difficult for all the mothers. So, if any of the mother is watching, it is very tough. Like, for example, we love our sleep. Like, I love to sleep for 8 to 10 hours. And now I'm staying awake till 4 o'clock. I'm waking up at 5 o'clock. So there's so much emotional trauma. There's so much mental trauma. You're physically tired. Also, there is a lot of hormonal imbalance happening. So there are two terms not normally what we say. One is postpartum blues and one is postpartum depression. Postpartum blues is something which you, like for example, like if I had a bad day today, how would I feel? Oh shit, yeah, I'm not feeling good. But for one day, if I have that, okay, that's okay. Or for 2 to 3 days, I'm feeling that, that is still okay. But for weeks and weeks, I am feeling sad, I'm feeling depressed, I feel super tired. So that is something which has to be taken care of, and that is not your postpartum blues. That is your postpartum depression, and it can get very severe. Like in my case, it wasn't that severe because I could only not connect with her because I was not getting my sleep, or also because my daughter was born during lockdown, so everything went into lockdown, so there was a lot of stress. So maybe that is the reason I was into depression. But I have also seen ladies who go into extreme depression of hating their bodies, also because a lot of changes happening in your body. You start losing hair, you lose your sleep, right? Your face changes, your appearance changes, so that is making you more depressed. Okay? Also, there are so many ladies who get this, like for example, suicidal tendencies, always upset, always anxious, depression. So it can go to that extreme level. So what I would recommend is, like for example, if there's a family member, so make sure the lady is taken utmost care, and if she is suffering from any of these things, do not take it lightly. Get a medical advice, or consult somebody, consult a psychiatrist, or consult a psychologist, or make sure that you understand the feeling of a lady, right? And it is very, very common, and especially in our generation where whichever patient I meet is depressed. I feel so sad. Like for example, every second, third person who comes with this thing called I am depressed. और ऊपर से पोस्ट डिलीवरी दिस इज बहुत प्रॉब्लम्स होते हैं, एंड पीपल शुड एक्सेप्ट इट कि ये प्रॉब्लम है और उसके लिए सोल्यूशन हमें लेना चाहिए. बिकॉज अगर आप डिप्रेस्ड हो तो टॉक टू समबडी, टॉक टू योर हस्बैंड, टॉक टू योर फैमिली मेंबर्स, और वहां से भी आपको सपोर्ट नहीं मिल रहा है तो टॉक टू अ साइकियाट्रिस्ट. उसके अलावा मेडिटेशन, yoga, listening to good music, resting, sleep is very, very important.
This was really means you have told a lot and lot about postpartum. Really, it was a very very interesting session. I think many of them joined, and they will also. It is actually a very knowledgeable session. I think for the new mothers, because you have told your own experience. That's a great one. Yeah. Yeah.
Thank you.
Thank you.
Thank you.
I'm so happy to have you here again. I'm telling you, I'm very, very honored to have you here. Thank
Thanks. I'm so happy that you chose this topic, because this topic is one of my, what do you say, the most favorite topic to talk, because I have already experienced it. Like I used to treat people post delivery before also, but now it's a different experience because I know how it feels. Like for
you.
example, सब लोग बोलते हैं ना कि I am having knee pain, तो मोस्टली पेशेंट क्या बोलते हैं मुझे कि मुझे पेन हो रहा है, आपको नहीं हो रहा है, so you don't understand the amount of pain I am having, so it is easier for you to say कि हो जाएगा ठीक. सो जो एक्सट्रीम पेन में होते हैं ना पेशेंट, दे से ऑल दिस थिंग, अरे डॉक्टर आपको नहीं हो रहा है ना तो यू वोंट अंडरस्टैंड हाउ मच पेन आई एम हैविंग.
Yes, that's
So
the
here
thing that, yeah, I have experienced all those things.
so I can talk. चलेगा चलेगा. Nice talking to you, Anvisha.
Yeah, it was a very nice session, even from my side also. And one thing I must say, that is, you're having such a cutie daughter. It's very, she's very, very cute.
Thank you. Thanks a lot. She's very naughty.
That's very normal. That's very normal. If being means if not being naughty is normal, I don't think not being naughty is normal. Being naughty is
Being naughty is very normal, yes. She's a lockdown baby, so we could actually spend a lot of time with her. Like me, my whole family, my husband, we literally spent like 6 to 7 months in the house with her.
That's a good thing. That's
Yes,
a
yes,
good thing
yes.
about
Yeah,
lockdown.
yeah. Blessing in disguise for us. So we enjoyed the first lockdown, but then we never enjoyed any lockdown. So we don't want any lockdown anymore.
Yeah. That's Thank you for thank you for having me. I mean, just joining me in this my with this in this session. I'm really very happy you joined me.
No issues, no issues. And thanks a lot for having me, and continue doing the good job what you're doing. You're putting a lot of efforts in posting regularly. Like for example, you're posting, I guess, every single day, which is very difficult.
Yeah, just trying. Just trying. Using my just means just lame hours means the means sitting lame. So just doing things, all these
Yeah,
things.
it's always better to do something. Yeah, very nice. Okay,
Yeah, just
fine. Yeah.
something or something I keep doing.
No, no, that's great. That's great. That's very nice. Okay.
Okay.
Okay, yeah.
Yeah. Ending this session here
Okay.
then. Thank
Sure,
you.
sure.
Thank
Thank
you.
you. Yeah, yeah. Bye bye. Good night.
Good night.